to your video lectures. For this week, we will be discussing about Module 2. Module 2 will be about the clinical laboratory. Just a few reminders before you start watching the video lecture. Number 1, please do take down notes. A PDF copy of the PowerPoint has been added to your Smart Kit. Second, listen attentively, avoid unnecessary distractions. And third, give extra attention to information marked with a star because again, if you will be seeing a star anywhere in the presentation, it means it may be a recall question in the board exam. It may be the actual question itself or it may be a related topic. So with that, let's discuss what are the learning objectives for today. Number 1, describe the different types of laboratories presented in the text and the common tests available in each. Second is identify the different departments in a hospital or reference laboratory and list some of the tests performed in these departments as well. Third, provide several reasons that laboratory testing might be performed. So, bakit ba pina-perform ang mga lab tests? Explain the roles a medical assistant might play in a laboratory setting. List and justify the various pieces of information that must be included on a laboratory requisition form. Explain the purpose of a lab directory as well as how a lab directory may be used when preparing to collect a specimen. Compare and contrast the function of a laboratory requisition and a laboratory report or result. Then last one, identify the different phases of lab testing and explain the flow of laboratory testing process. So, kung ano ba talaga ang nangyayari pag tayo ay nagkakaroon ng mga lab tests. So, ano ba yung parang mga step-by-step procedures at ano yung mga kailangan. So, pag-uusapan natin yun today. Then, provide examples of pre-analytical, analytical, and post-analytical procedures and how they affect the quality of laboratory testing. So, with that, let's start the discussion proper. Introduction. A clinical laboratory is any place where specimens from the human body may be collected, processed, examined, or analyzed. So, ito nga po yung ginagawa talaga ng mga medical technologists is under the clinical laboratory or just laboratory itself. So, hindi lang po kasi clinical laboratories natin. So, marami siyang different types. But, one of the most common po na pwede nyong pag-workan kapag kayo po ay naging RMT na is yung mga clinical laboratories po natin. Here in the clinical laboratories, ang pinaka-concern po natin here is specimens from the human body. I repeat ha, specimens from the human body. Although meron po kasing mga laboratories for animals, ganon, but they have somehow a different training pa. Unlike sa ating mga normal na mga medtechs or mga medical laboratory scientists, we are dealing mostly with specimens from the human body. From the collection, so paano natin kinolect yung sample, yung process niya, kung paano natin siya parang ipe-prepare. Also, paano natin i-examine. So, yun nga kasi yung role ni medtech. And of course, paano natin i-analyze yung test results niya. With this broad definition in mind, then, laboratory may be someone's home. So, pwede po mga laboratory natin, somehow a home-based laboratory. Although, yung home-based laboratories na to, dapat clinic pa rin siya at meron siyang lisensya to operate. A long-term care facility, pwede din dyan. The office of a healthcare provider. So, ito, yung mga clinics natin na merong mga doktor. Free clinic o yung mga freestanding clinics natin. A hospital, of course. Ang mga big hospitals po, dapat merong laboratory. A small facility used strictly for specimen collection and processing. So, meron pong mga laboratories na sila lang yung taga-kuha talaga ng specimen but hindi sila yung taga-test. So, may mga ganung laboratory po. Also, or a large and complex reference laboratory. So, di ba, ang daming pwedeng pagtayuan ng laboratory because, again, the laboratory test is vital so that we may be able to help the doctors in the diagnosis of the patient. So, dapat talaga, lab test, laging nandyan yan bago mag-diagnose ang isang doktor. So, mga parang supporting evidence kasi yan nung parang picture kung ano talaga yung sakit ni pasyente. So, what are the different types of laboratories? We have 3, yung pinaka-main. The first one is the physician office laboratories, also known as POLS or POLS. Ayan. So, these are clinical laboratories within the physician's office. O yung physician po, meaning doctor. So, may mga physician's office po tayo na nandun po talaga si doktor, parang sarili niyang clinic yon at yung clinic niya ay may sariling laboratory. So, yun po yung physician's office laboratories na example. This is where laboratory testing is carried out on specimens obtained from the practice's own patient. So, pwede kasing nangyari dito sa mga polls is, kunwari nagpa-check up ka. So, syempre magpapa-check up ka kasi may nararamdaman ka. So, si doctor magre-request yan ng lab test dun sa sarili niyang lab, dun sa clinic niya. So, yung sinasabi dito na obtained from the practice's own patients is yung mga nagpapa-check up dun sa doktor. Okay? This type of laboratory can be advantageous because the results for tests performed on-site are available quickly and patient treatment can begin immediately if necessary. So, kasi kapag po yung laboratory is within the vicinity na ng ating doktor, so mabilis lalabas yung resulta ni patient ngayon. It will be available quickly at mabilis po na natin mai-start kung yung kailangan ba ng treatment ni patient. Okay? The testing and specimen collection in these office laboratories may be accomplished by various members of the healthcare team, such as medical assistants trained to perform such procedures. So, yung ito po sinasabi na specimen collection lang po ito ha. Kunwari kukuha lang ng dugo, kukuha ng ihe or other body fluids. But definitely, si medtech pa rin po ang authorized na mag-test. Okay? So, yung mga medical assistants natin or pwede rin natin sabihin mga laboratory technicians or assistants, although they are parang trained naman for specimen collection, however, the testing itself can only be done by a medical or registered medical technologist. Okay? A second type of the laboratory is yung hospital-based laboratory. So, nandun na yung term, di ba, hospital laboratories, meaning this type of laboratories is present in the hospitals. Okay? It generally offers laboratory testing that meets the needs of their respective institutions. Meron po kasi mga certain hospital, I'm not sure if you are familiar, meron po tayong mga specific hospital na ito lang po yung mga sakit na i-cater niya. So, since ito lang yung mga sakit na i-cater niya, ito lang yung pwedeng mga laboratory test na present doon. Okay, so that's just a good example, okay? Then, in most situation, hospital laboratories perform high volumes of routine test procedures. Kasi po marami pong tao sa hospital, marami tayong pasyente. So, dapat talaga kapag ang isang laboratory ay nasa hospital, kaya niyang mag-cater to a high volume of tests and yung samples. Okay? Lalo na especially nung kasagsagan ng Delta variant, nung masyadong mataas yung cases every day, definitely, busy yung mga laboratories natin noon. Okay, hospital laboratories may also serve as a reference laboratory for the local community, especially for stat testing needs. Yung stat po, meaning niyan, si stat meaning is immediately or dapat mabilis. Short turnaround time. I repeat, stat, pakilagay po sa notes nyo, it means short turnaround time. So, dapat mabilis. So, this is vital for emergency. Yung mga emergency cases natin, dapat stat yung testing nila. A good example of test na parang automatic na siya, na stat siya dapat, is yung mga pasyente po na nasa emergency room. So, dun sa pinag-interna ni ma'am, kapag kami po ay nasa ER or emergency room, regardless kung ano man po yung complaint ni patient na nabaril, or minsan sumasakit lang yung tiyan, ganyan. Kapag po nasa emergency room, most of the time, dapat start po talaga ang ating testing natin. So, that is dapat within 1 hour na ibigay na natin yung result ni pasyente. Okay, yun yung maximum. Maximum time para i-turn around or ibalik sa doktor yung test results. Hospital laboratories may also offer another method of core testing samples called point-of-care testing or POCT. Ma'am, what is POCT? Pag sinabi po natin POCT or point-of-care testing, these are yung testing na can be done bedside of the patient. I repeat, point-of-care testing or POCT, it means those tests that can be performed bedside of the patient. So, kumbaga, kung si pasyente nakahiga sa ward or sa bed ng hospital, yung test na to, kaya mong i-perform sa tabi niya. Okay? Then, meron kasi mga test na dapat sa loob lang ng laboratory ginagawa eh. But ito pong point-of-care testing, these are again tests that can be done bedside of the patient. Okay, next. Here is test performed at a hospital laboratory may include the following. Although, class, not all hospitals can cater to all of this, but these are just the list of the most basic tests that they can actually do. Okay, so first is electrolytes. Electrolytes such as your sodium, potassium, calcium. Second is kidney function test. Third is liver function analysis. Fourth, blood typing and cross matches for blood transfusion. So, kapag po nagkakaroon ng blood transfusion, kailangan itong gawin yung blood typing tsaka cross match. Identification of microorganisms such as bacteria and antibiotic sensitivity testing. Ito pong si antibiotic sensitivity testing, this is actually used to check if anong mga antibiotic pa yung nag-work sa patient natin. As we all know, very rampant ngayon yung antibiotic resistance because of the wrong usage of antibiotics. Meron kasing mga tao, class, na konting sakit, nag-antibiotic agad, eh hindi naman po effective ang isang antibiotic sa lahat ng sakit. Okay? May mga specific pong antibiotic na pwede sa mga sakit na ganito. So, due to that, nangyari ng antibiotic resistance, antibiotic sensitivity testing is vital now, so that we may be able to know what antibiotics is successful pa dun sa patient natin or gumagana pa for him or her. Also, madalas po itong ginagawa, urine analysis. 7 is coagulation testing of the blood. Sa blood po ito. Number 8 is cardiac enzyme assays. So, ang cardiac enzyme assays natin, class, it is a good indicator. Marami pong mga enzymes yan. But this is a good indication of a heart attack. So, kapag ang isang pasyente is suspected to have a heart attack, the doctor can actually check for the cardiac enzyme assay. And number 9, complete blood counts and other hematology testing. These are the most common tests performed in a hospital laboratory. Although, ito pong mga test na ito, pwede rin po ito actually gawin dun sa ating mga physicians-based na laboratory. But very limited po kasi kapag maliit lang po yung clinic natin, such as the pulse. Unlike the hospital laboratories na malalaki, they can cater to a high volume of routine test procedures at marami pong mga available tests sa kanila. Third, reference laboratories. It performs more tests annually than either pulse or the hospital labs, processing perhaps thousands of specimens per day. This test includes those that are performed at a hospital laboratories, but reference labs may offer specialized testing that is not performed at either the hospital labs or the pulse. So, ito po mga reference laboratories na to, they can cater now to those specialized tests na hindi siya readily available sa ating mga hospital-based or yung mga clinic-based or yung mga freestandings natin or yung mga physician's office laboratory. So, yung mga specialized testing na hindi commonly performed kasi it's either there is no need for it in a routine test or baka naman sobrang mahal kaya siya special. So, pwede po yung i-perform sa ating mga reference laboratories. But still, it is based on availability of that specific test in that laboratory pa rin naman. But definitely, yung mga reference laboratories natin, pakikita ko po sa inyo yan later, yung kung ano yung mga list ng reference labs here in the Philippines. But definitely, those reference laboratories can perform specific or specialized testing na hindi siya readily available dun sa mga normal na laboratories natin. Okay, so ito na yan. Ito, class, pakinig. Take note, meron po tayong star. Then, A national reference laboratory is required to implement quality assurance. So, yun po kasi talaga yung purpose ng mga reference laboratories natin aside from giving specialized testing. Sila po talaga yung nag-i-implement ng parang rules to check for the quality of all of the laboratories here in the Philippines. Although sa ibang bansa class, meron din po tayong mga iba't ibang national reference lab. But ang concern po natin right now is yung mga reference laboratories here in the Philippines. Okay? Again, ano nga daw po ang purpose ng ating National Reference Lab? That is to required to implement quality assurance purposes for all of the laboratories here in the Philippines. So, para kasi yung mangyayari dito is i-check natin kung yung certain laboratory is nandun pa ba siya sa tinatawag nating quality testing. Like, quality pa ba yung nilalabas niyang result? Quality ba yung mga medtechs na nandun sa area na yon? So, yun po yung parang pinaka-purpose ng ating mga national reference labs. Okay? Then, the NRL also interacts with the supranational reference laboratory network. So, ito nga po yung inter-country na. All countries should have a national reference laboratory. But then again, ang concern po natin here is the reference laboratories here in the Philippines. Please do take note of the following. There is one recall question here before in the board exam, and that is the National Reference Laboratory for Biochemistry. The reference lab for biochem here in the Philippines is the Lung Center of the Philippines. I repeat, the National Reference Lab for Biochemistry is the Lung Center of the Philippines. Please do take note, this is a recall question. So, since ito recall question yan, ito po yung tanong, dapat alam nyo din yung mga ibang departments at kung ano yung national reference lab ng mga yan. So, first, we have here infectious diseases and microbiology. We have the RITM, that is the Research Institute for Tropical Medicine. For drug testing, yung mga shabu, cocaine, tinetest yan sa IHIP. That is for East Avenue Medical Center. Cardiac diseases and pathology, we have the Philippine Heart Center. So again, biochemistry ha, pakitake note po, recall question yan. Lung Center of the Philippines. Hematology, we have the National Kidney Transplant Institute. Newborn screening test, ang ating reference lab for that is the National Health Institutes. And yung HIV and other STDs, STD class means sexually transmitted diseases, yung mga diseases po or sakit na nahahawa due to sexual contact. So HIV and other STDs, that is for San Lazaro Hospital, Sakel. Yung SLH po, that is again San Lazaro Hospital. Ito po yung malapit sa school natin, sa Tayuman to yung SLH. Okay ha, paki-take note po dito. Types of laboratories, ito yung tatlong pinag-usapan natin, right? Physician's office, hospital labs, and reference lab. Ito po yung mga possible testing that can be performed in those types of laboratories. Hindi nyo naman to kailangan class kabisaduhin, but be familiarized with this. Na kapag physician's office lang yung lab, medyo limited yung test na kaya niyang i-perform. It can perform wave test. Yung mga wave test po, ito yung mga test na kahit papano pwede pang gawin sa bahay without causing harm to the patient. We also have the moderate complexity testing and microscopic examination such as yung urine, mga ganon. Madadali lang yan gawin. Next is your hospital laboratory. We have the wave test as well. The moderate and high complexity tests. Then point of care testing, di ba binanggit natin kanina kay hospital labs. And microscopic examination. So basically, si hospital lab, kaya niyang i-cater lahat ng kayang i-cater ng physician's office plus high complexity tsaka point of care. Then, reference laboratories po natin, halos lahat kaya niyan, wave test, moderate and high, tsaka microscopic examinations. So, that is the sample test that can be performed by the different types of laboratories presented kanina. Okay, next. So, we are now done with the different types of laboratory. Ngayon, pag-usapan naman natin, what are the different laboratory departments? So, yung laboratory kasi natin, class, it is divided pa into different sections. So, basically, hindi po sama-sama lahat ng section ng laboratory. Hiwa-hiwalay po sila. So, isa-isahin natin ngayon what are the different departments or possible departments of the laboratory. Please do take note that not all laboratories can have all of this department, but these are just the most common and the most basic. Okay? So, pwedeng may kulang dito sa listahan or pwedeng mas marami pa siyang department. It depends on the capacity of the laboratory pa rin naman. So, first, we have the specimen processing na department. So, this is somehow related to specimen collection. Ayan nga. The area of the laboratory where all incoming specimens, yan, incoming pa lang, so papasok pa lang sa lab, are sorted, accession, so pinipila, yun po ibig sabihin ng accession, into the computer system of the lab, and appropriately labeled. Mahalaga po ito sa atin, dapat po may label kapag selected. Okay? walang label dito. Dapat po ang mga medtech laging may label. It is a mortal sin sa ating mga medtech na kapag yung specimen natin ay walang label. Okay, so for transport to the respective departments for testing, the specimen processing department may also prepare specimens for transport to reference laboratories. So, pwede din po kasing ganito. Yung test na gusto mong i-perform is wala dun sa laboratory nyo. So, ang gagawin mo ngayon para i-cater mo yung test na binigay sa inyo is ibigay nyo po siya sa ibang laboratory or to a reference lab. Okay? Then, next department, class, we have your hematology. Hematology department processes whole blood testing which focuses on the formed elements or the blood cells. Dito nyo po matatagpuan yung red blood cell, white blood cell, platelets in the blood, mga blood components po yun. Sa hematology department po natin siya tinetest. Coagulation testing is also performed in this department. So, magkasama po yan, yung whole blood, yung coag, most of the time, both of this is in the same department of hematology. Next department, we have your clinical chemistry. Testing performed on plasma or serum, the liquid portion of the blood. So, kunwari class, ito yung whole blood nyo. Ito yung nasa test tube. Kapag po kasi naghiwa-hiwala yung blood components natin, meron po yung hihiwalay na liquid portion, which is known as plasma or serum. I will identify kung ano yung pagkakaiba nila as the SEM goes on. Meron po tayong specific topic for that. But for now, it is good to know that in clinical chemistry, most of the time, we are concerned with the plasma or serum, which is ito pong kulay dilaw na ito. This is the liquid portion of the blood. And this includes the analysis of substances dissolved in the bloodstream or the analytes. Most testing is automated na and many of the tests are performed as panels or group of tests. So, sa amin po, sa clinical chemistry in my laboratory before, fully automated po yung machine natin here. Which means, machine na talaga yung gagana. Hindi siya manual testing most of the time. Okay? Kasi mahirap naman po i-test ang mga analytes natin na nasa plasma or serum ng manually. So, most of the testing that is performed in ClinChem is fully automated na po talaga. Next department here, we have your serology or otherwise known as immunohematology. So, isa lang po yung ibig yan sabihin. Parang other name lang to. The testing here focuses primarily on the presence of antigens or antibodies on cells or in the liquid portion of the blood as well. Sige nga class, kung nakikinig ka lang sa last slide, ano nga daw po ulit yung tawag dun sa liquid portion of the blood? Again, what is the liquid portion of the blood? That is, diba, serum or plasma. Okay. So, magkaiba po yun ha, yung serum tsaka plasma, but that is termed as the liquid portion of the blood. Meron po silang major difference, but still, liquid portion of the blood po yun. So, using the serum or plasma or the liquid portion of the blood, we are now detecting now in the serology or immunohematology department the presence or absence of antigens or antibodies. So, this is something to do with your immune system. Baka narinig nyo na si antibodies, diba? Diba? Antibodies against COVID, yung vaccines, ganyan-ganyan. Nandun papasok yung antibodies nyo. yun po yung tinatest natin siya. Then, blood typing and antibody screens and cross matches for transfusion may also be performed in this department. So, what if kinailangan mong salinan ng dugo? Kasi, kunwari, na-aksidente ka, nasagasaan ka, kinailangan mo ng dugo. So, bago magpasok ng dugo sa inyo, foreign blood sa inyo, blood typing and antibody screen tsaka cross-matching should be performed on the bloods first for safety purposes. Hindi po pwedeng basta-basta magkaroon ng blood transfusion or salinan ka agad-agad ng dugo without testing. So, it is vital first to check for the blood type. Dapat compatible yung blood types nyo and yung cross-matching nyo. So, dapat nagmamatch yung inyong dugo dun sa yung magdodonate sa'yo. So, that is in the serology and immunohematology department. Next department here, we have the urinalysis or the clinical microscopy department. The physical appearance of urine is assessed and urine chemical and microscopic analysis is performed here. So, dito po sa ating urinalysis, kaya nga po siya urinalysis, urine, yung dun po nga sa urine or ihe, and then analysis is pag-test. So, pag pinagsama, urine, tsaka analysis, urinalysis means the testing of urine, either through its physical appearance, its chemical composition, and microscopic analysis as well. Tayo po ang gumagawa niyan under clinical microscopy department. Next department po, here we have your microbiology department and the parasitology. Magkaiba po itong dalawa, but pwede po silang magkasama. Then, microbiology, sa micro po, paki-take note ha, ito po yung meaning ni micro, kung ano yung ginagawa dyan. Microbiology, identification of pathogenic microorganisms such as your bacteria and antibiotic sensitivity testing. Ayan, diba? Diniscuss ko kanina kung para saan si antibiotic sensitivity test. Diba? Chine-check dito kung ano po mga antibiotics or gamot ang pwede sa pasyente at effective pa sa kanya. Because again, ang ating antibiotic resistance kasi is somehow mataas po ngayon. Dahil inom kasi yung iba kasi talaga class, inom ng antibiotic kahit hindi naman para dun yung antibiotic sa sakit nila. Kaya ngayon, kung mapapansin nyo, sa ating mga pharmacy, mahirap na po kumuha ng antibiotic. Kailangan may reseta ka talaga. Unlike before, mga circa early 2000s, diba? Parang sabihin mo lang, pharmacist, pabili nga po ako ng amoxicillin. Bibigyan ka na agad. That is before. But now, class, maski yung simpleng amoxicillin is highly regulated. Kailangan po meron kayong reseta. Okay, next po, here we have your parasitology. Parasitology, identification of your parasites such as roundworms, amoeba, etc. So, yung mga parasites, andyan po yung mga uod sa tiyan, mga ganun po yung mga parasites natin. Please do take note that in the Philippines class, ang madalas pong magkasama actually is the clinical microscopy and parasitology department. Okay? Madalas magkasama sila, sa isang department sila. But meron po kasi tayo mga laboratories na magkakahiwalay po itong mga ito. So, this really depends on the lab kung ano yung trip nila at kung ano yung pinaka-convenient sa kanila na department na magkasama. Okay, another department is yung coagulation, di ba? Again, saan nga ba ito pwede ulit? Kaka-mention lang, saan nga po ulit pwede yung coagulation? That is under hematology. So, ito. Ayan naman, diba? Si coagulation can be under hematology. So, okay? So, coagulation, specimen testing for the presence of various clotting factors. This is a vital test for surgical procedures. So, kapag po kasi this is a major surgical procedures, yung mga talagang kailangan patulugin ka and stuff like that. Of course, kung kunwari, bibiyakin nila yung tiyan mo kasi may kukunin sila, that can induce bleeding kasi. Kasi binuksan nila yung yung katawan mo eh. So, of course, may bleeding na pwede mangyari dyan. Ito-check ko po dito kay coagulation if kaya bang mag-stop or mag-cessate yung bleeding mo. Kung ikaw ay mag-undergo ng surgical procedure. So, dapat kasi normal po yung parang function ng ating clotting factors para hindi ka mag-bleed to death. Kasi what if meron ka palang problema sa coagulation ng blood mo? Hindi ka agad-agad nagka-clot or o di kaya masyado namang matagal or talagang masyadong hindi nagpa-function ng tama yung clotting factors natin. So, kung ikaw, binuksan ka bigla dyan ng doktor under surgical procedure, binuksan ka, hindi nag-stop yung bleeding mo, mamamatay tayo, imbis na makatulong sa atin yung surgery. So, it is a vital test for surgical procedures, yung coagulations po natin, coagulation test. Also, we have the Department of Cytology. Yung cyto class, this is something to do with your cells. So, yun po yung ibig sabihin ng cyto is cells. Ito, cells. Ayan. So, under cytology, we are examining various specimens for abnormal cells, chromosomal studies, and pap smear. Ang pap smear, I believe, is a test to check for cervical cancer in women. Okay, so dyan po natin yan i-check. So, under cytology, we can check for the presence of abnormal cells. Baka cancerous pala yung cell na yun. So, pwede po natin yan i-test under cytology. But ang madalas po, based on experience lang naman, on my hospital, cytology po ang chine-check talaga dyan is yung pap smears. Diba? So, to check for cervical cancer for the women. So, yan po ang madalas na ginagawa sa cytology in the hospital that I have interned in. Then, we also have the Department of Histology and Pathology. Histo, ibig sabihin yan tissue. Okay, ayan, tissue. Uy, klase dito yung tissue paper. Yung tissue po na ito is yung nasa loob ng katawan natin. Di ba? Meron tayong cells, organs, tissues, ganyan. So, yun po tayo. Histology, again, something to do with the tissues of the body. So, pathology naman is the study of diseases. So, pag pinagsama histology tsaka pathology, that is known actually as histopathology. So, under here, we are examining tissue samples for abnormal function and form. So, pwede natin makita dito kasi if a certain someone is developing a type of cancer, mga ganun po. So, yun pwede natin tignan sa histopathology department. But, please do take note, madalas po in the hospitals or in the major clinics, magkasama po ang histopath tsaka cytology. Okay? So, madalas magkasama na sila sa isang department. Because, halos iisa lang naman kasi yung parang pinaka-main na ginagawa nila. Diba? Checking for abnormal function, abnormal cells, abnormal tissue. So, madalas magkasama sila sa isang department. But, again, pwede po yung magkahiwalay depending on the availability sa ating mga laboratories. Okay, so summary of the laboratory departments and common tests performed and specimen types po na acceptable dito sa mga department na pinag-usapan natin kanina. Note that not all laboratories can perform each test mentioned. So, again not all laboratories can perform each test mentioned. But ito yung mga possible na kaya nilang i-perform. At ito yung mga pinaka-common. So, in the specimen processing, so, incoming specimens are sorted. Specimens accessioned into the computer system. So, basically, ini-input yung information sa ating computer. Specimens labeled and prepared for testing in separate departments. So, dyan po yung specimen processing natin. Specimen types na acceptable dyan is lahat ng pwede. Hematology, complete blood count. So, yun mga po ipapasok yung RBC, WBC count, platelet count. Also, hemoglobin and hematocrit measurement. So, nasa blood din kasi yan. The coagulation studies, please take note ha. Nasa hematology po yan. ESR, differential white blood cell count and platelet counts. Nasa under CBC nga po yan. Ang specimen po na acceptable sa ating hematology is your whole blood. Next, clinical chemistry, we have again your electrolytes such as sodium, potassium, calcium, glucose or blood sugar, blood urea nitrogen, creatinine, your thyroid testing, cardiac enzymes to check for possible myocardial infarction or heart attack, comprehensive metabolic panel, cholesterol and lipid testing, and many automated chemistry tests and panels. Ang specimen na acceptable po sa ating clinical chemistry can be serum, plasma, Urine, pwede din po natin i-accept dyan. And then, we will try to check for the presence of the substances. Cerebrospinal fluid. So, yun nasa nervous system natin yan. And amniotic fluid is acceptable for clinical chem. Next is your serology and immunohematology. We can test here for various tests looking for antigens and antibodies such as your RPR, mononucleosis testing, HIV po. Ang HIV screening and test po nasa serology, immunohematology section po yan. Okay? Chlamydia, anti-streptolysin O, pregnancy test can be under serology and immunohematology. CRP, the ABO-RH blood typing, antibody screen and cross-matching for blood transfusion, newborn testing, and prenatal testing. All of this can be under serology and immunohematology. The specimen type acceptable for this department is serum, plasma, or whole blood. Next po natin is under the urinalysis department or the clinical microscopy department. We have the physical appearance of the urine is to be checked. So, tama ba yung kulay ng urine mo? Meron po kasi mga indications yan kung kakaiba yung kulay ng urine. Like example is isang lalaki, hindi naman nire-regla, right, ang mga lalaki, but yung urine niya is reddish. So, that can be an indication na merong bleeding somewhere in his urinary tract. Then, we also have your urine chemical analysis and microscopic urine analysis. Then, of course, since urinalysis ang pinaperform natin, ang specimen acceptable for that department is urine. Microbiology and parasitology, ito po, very broad po yung specimen types here. Marami siyang pwede. And in the microbiology and parasitology department, we can check for the identification of pathogenic microorganism, streptococcal screens, antibiotic sensitivity testing, at marami pa pong iba. These are just the most common. Then, ito po yung mga specimen types. Halos lahat po ng ating blood samples, blood, body fluids, at kung ano man, pwede po yan dito sa ating microbiology. So, kung nasaan man ang infection sa'yo, pwede kang kuhanan dyan. Cytology. Cytology, we can check or examine of various specimens for abnormal cells to check for cancer and stuff like that. Chromosomal studies and pap smears. Pap smears, ayan po ha, sa mga babae po yan to check for cervical cancer. Specimen types accepted for cytology is urine, skin, tissue specimens, yung biopsy nga po na tinatawag, so pwede po yun, and sputum is acceptable for cytology. Coagulation again is testing for the presence or absence of adequate clotting factors. And ang acceptable po kay coagulation studies is whole blood. Histology, pathology, or histopathology, examination for abnormal form and structure in tissues. Then, specimen types na acceptable is tissue organs, biopsies from various parts of the body, preserved and fresh specimens are examined here. Okay, mamandami na nating nakapag-usapan na laboratory test. Pero bakit ba talaga natin siya ginagawa? Bakit ba may mga medtech pa na magte-test ng mga lab test na yan? So, what is the main reason why is laboratory testing performed? Laboratory testing is critical for appropriate patient treatment. Actually, ang sinasabi nila, ang diagnosis po ng isang pasyente is 70% is based on the laboratory results. So, imagine, ang mga diagnosis natin na yan, kung isang tao ay may ganitong sakit, 70% of that almost is coming from the lab test results. So, with that in mind, of course, very vital po ang lab test. Malaki po ang role natin as medical technologists para ma-diagnose po natin ng maayos ang pasyente. At since kasi kung na-diagnose natin ng maayos ang ating pasyente, kaya natin siyang pagalingin doon. So, the results obtained from a blood test or evaluation for other types of specimens from the human body are essential for the healthcare provider. Si healthcare provider po is our doctor. To gain information that is not available through the patient history or physical examination. Sige nga, ang isang tao ba, masasabi mo bang may cancer siya just because masama yung pakiramdam niya. Like, laging sumasakit yung ulo niya and stuff like that. Masasabi mo ba agad-agad na just based on the physical examination of this patient, may cancer siya? Of course not. So, ang magda-diagnose po kasi dyan talaga, aside from the signs and symptoms, yung physical exam niya, is yung kanyang laboratory test. So, that is just a good example. Healthcare providers generally order laboratory tests for at least one of the following reasons. Number one is to assign a diagnosis. Si doctor po ang nagda-diagnose sa patient. Paki-take note po yan na tayo mga medtech, although naiintindihan po natin at meron tayong idea kung ano ang diagnosis ni patient just based on the lab test, but still, medical technologists do not diagnose a patient. I repeat, medtechs do not diagnose a patient. But still, kahit hindi tayo yung nagda-diagnose sa patient, dapat meron po tayong idea na kapag ito yung lab test niya, baka ito yung kanyang sakit. But still po, ang magda-diagnose dapat sa pasyente is si healthcare provider or yung doctor po natin. Kasi po, kinokorrelate po yung lab test niyan sa signs and symptoms ng ating pasyente. And other testing pa na pwedeng gawin sa hospital, hindi lang lab test. Okay? Also, prevention or early detection of disease through screening test. So, kapag ikaw naman ay, feeling mo naman healthy ka, ganun, wala kang nararamdaman eh. But, for example, bigla kang nagpa-test out of nowhere, so, na-detect natin na meron kang ganitong sakit. So, with that, maaga nating na-detect, mas maayos ka nating magagamot. Then, ongoing assessment also of the patient's progress and treatment. So, isa pa yun sa reason kung bakit pina-perform ang lab test. Chine-check natin kung yung pasyente ba natin is gumaganda yung lagay niya. Okay? Good example. Isang batang nagkaroon ng dengue. Mostly class, kapag meron ka kasing dengue, ang pinupunteriya talaga niyan is yung platelet count natin. Okay? Yun yung nasa blood, yung platelet. Then, kunwari, first day na na-diagnose ang pasyente, merong dengue using CBC tsaka yung dengue NS1 antigen test sa serology. So, okay, may dengue si pasyente, ang baba ng platelet count niya on the first day. So, tapos si pasyente ngayon is nagstay sa hospital. Kailangan niya kasi ng monitoring eh. So, pinagstay siya sa hospital, naka-confine siya ngayon. On the 5th day na naka-confine si patient, nakita mo ngayon na tumaas na yung platelet niya. So, meaning, nagkaroon ng progression yung patient natin. Unti-unti na siyang gumagaling. So, yun ang isang good example on what is the purpose of the lab test based on the ongoing assessment of the patient's progress in treatment. Okay, so pwede kasi nating makita na based sa lab test na ito, gumagaling na to kasi tumaas na yung platelet count niya. So, yun po ang ongoing assessment of the patient's progress. So, these are just the most common reasons kung bakit pina-perform ang ating mga lab test. But, although, ito lang yung nilist natin, marami pa pong iba. But, these are just the most vital kung bakit talaga pina-perform ang mga lab test na yan. So, malaki po ang role ng mga medtechs sa mga patient's diagnosis. Although, hindi tayo yung nagda-diagnose. But, definitely, the results that we will cater to the patient can help him na gumaling pa or ma-prevent talaga mismo yung disease. Okay, next topic here we have the information flow in the clinical laboratory to ensure that lab test results are as meaningful as possible to the healthcare provider. All those involved with specimen collection, processing, and testing must use the required paperwork and database correctly. So, inside the laboratory class, it is vital po na yung information is provided ng malinaw sa ating lahat. So, paano natin masasabi na ang information flow in the laboratory is maayos? So, this information exchange will involve a number of different things. First is a laboratory requisition form. So, request form po yan. Yun yung ibig niya sabihin. A laboratory directory. A computer database. Kasi po, ngayon naman class, madali naman na mag-computer, right? So, almost all of the information sa laboratory should have a computer database. So, para doon na tayo mag-i-input, hindi na natin siya susulatin manually. And, of course, the laboratory report or test results. So, nandito po yung test results natin. Okay, let's check. A laboratory requisition or a lab request form. A laboratory requisition is the form used by the physician or other qualified healthcare professional to document that the tests that are to be performed to a patient. Okay? So, kumbaga parang ito yung request form nga na kung saan ilalagay ni doctor kung anong mga test ang i-perform natin sa pasyente natin. Although all laboratories may use unique formats, standardized information should be present on all requisition forms for testing and reimbursement purposes. So, ang ating mga laboratory requisition form, depende po yan ha sa clinic or laboratory. Kung ano yung itsura niya, kumbaga. Baka gusto nila may picture, may kung ano-anong ek-ek, ganyan. But definitely, dapat po meron siya mga vital information na sa lahat ng laboratory requisition forms is present. Okay? So, ito nga po yun. Patient demographic information, of course, yung name at birth date niya. Mawala na lahat, wag lang yung name tsaka birth date ni patient. Kasi kung walang pangalan yon at walang birth date, paano natin i-identify na siya yon? Diba? So, again, demographic information such as the name, address, phone number, and birth date. Pero itong sa apat na ito class, ang pinakamahalaga po dito is the name and birthday. Okay, mawala na lahat, wag lang yon. Patient gender, male or female. Meron po kasi tayong mga parameters na magkaiba kapag male or female yung ating pasyente. Also, complete patient insurance and billing information. So, ito naman, kahit hindi naman nato kasama, but sige, isama pa rin natin siya as a standardized procedure. Date and time of collection and identification of the person who performed the collection. So, meron po kasi tayong mga test na kailangan, meron siyang specific na time mo lang siya i-collect. Okay? And also, kung sino yung nag-collect ng dugo, for example, dapat nakalagay yung pangalan niya doon sa requisition form. Kasi ang pwedeng mangyari, kung hindi natin malalaman kung sino yung kumuha ng dugo, nagkamali siya, lahat tayo damay-damay sa lab, okay? So, aside from that, mahalaga din talaga na alam po natin sino yung nag-collect ng specimen. Okay? Documentation of how the results are to be relayed to the healthcare provider who ordered the test, and documentation of any other practitioner who is to receive a copy of the results. So, what does this mean is yung documentation. Documentation of how the results is to be relayed is, paano ba natin ibibigay yung resulta sa doktor? Is it through paperwork? Bibigay ba natin to sa department nila? Or tatawagan ba natin sila kasi emergency to? So, somehow, that should be relayed on the requisition form. Next, appropriate diagnostic information in the form of an ICD-10 code na po tayo. Paki-take note ha. Paki-update po ito sa inyong mga modules at sa inyong notes. We are now following the ICD-10 code. But this ICD-10 code actually is not being utilized here in the Philippines. Okay? Here in the Philippines, kapag naglagay ng diagnosis si doctor, is yung diagnosis itself, as in yung words. Like, kunwari, urinary tract infection, UTI, ganon. But in the US, ito kasi sa US po ito. Nung nag-work ako sa US din, ICD-10 code po yung pina-follow namin. Hindi na po ICD-9. Okay? Paki-take note. Again ha, ICD-10 code. So, code po ito ng mga diagnosis, mga sakit-sakit. And this is to allow for reimbursement for the test order. Kasi nga po sa US kasi class, meron po silang health insurance. Okay, and most of the time, ang kanilang mga health insurance actually pays for the laboratory test. Unlike here in the Philippines, napakahirap. Maski yun sa PhilHealth na lang, napakahirap pa magpa-reimburse ng mga nagastos mo sa hospital. Unlike in the US, maganda po yung kanilang healthcare na, yung healthcare nila in general maganda. Kasi may mga insurance po doon. Also, test selection, clearly marked with a check, circle, or X in the appropriate area on the requisition. Test may also be written if they are not printed on the requisition used. So, of course, aside sa pangalan ni pasyente at birthday niya, si doktor, kailangan alam din natin kung sino. Of course, yung test na gagawin natin sa pasyente should be seen in the laboratory requisition form. What if kasi ang pinasa lang sa inyo, request form, tapos wala namang test na gustong i-perform? Ano gagawin natin? Wala. So, dapat po, yung test selection po is naka-indicate kung anong test ang dapat i-perform sa pasyente. hindi naman pwede lahat class is i-perform natin sa kanya kung walang nakalagay. Okay? That is, hindi po yan economically okay. Kasi mahal po yung mga lab test natin. And also, any additional comments that may assist with ordering or interpretation of the test. Baka merong mga specific instructions si doctor, so pwede niya rin ilagay dun sa ating requisition form. Okay, so itong mga makikita nyo class na merong check ngayon, mawala na lahat-lahat ng mga ito. Yan. Itong mga nilista natin, mawala na ang lahat maliban sa mga sumusunod. So, ayan, merong una tayong check here. Una is, of course, the patient demographic information, which is the name and birthday. Okay? Mawala na yung address tsaka phone number niya, wag lang yung name tsaka birthday niya. Okay? Also is the patient gender, kung male or female siya. Because again, meron po tayong mga test na magkaiba po yung normal values kung ikaw ay babae or lalaki. So, dapat naka-indicate po yan. Also, yung date and time of collection and identification who performed the collection. Kasi nga po, meron tayong mga test, meron tayong mga test kasi na may specific time lang siya pwede kunin. And of course, mahalaga na kilala natin kung sino yung kumuha ng dugo or kung anumang specimen yan. Para kung sakaling magkaroon ng problems, alam natin kung sino yung pwede nating unang pagtanungan kung paano nagkamali. Okay? Also, documentation of how the results are to be relayed to the healthcare provider. Ang mahalaga po dito, actually, kaya ko siya nilagyan ng check, is dapat po dun sa requisition form natin, alam po natin kung sino yung nag-request na doktor. Again, I repeat, kaya ako po nilagyan ng check to, aside sa yung documentation of how the results are to be relayed to the doctor, ang pinakamahalaga po actually here is yung requesting physician or yung requesting doctor. Okay? So, dapat dun sa ating requisition form, nandun po si requesting physician or doctor. Dapat naka-indicate siya dun. And of course, yung test selection, kasi kung anong test ba ang kailangan i-perform sa pasyente. So, dapat alam natin. Dapat naka-check siya, naka-circle, or merong X. Or pwedeng isulat din ni doktor kung wala naman dun sa requisition form yung test na gusto niya. Then, ito pong diagnosis, yung patient insurance and billing information, tsaka any additional comments, these are just optional po. Okay? But definitely, yung mga nilagyan ko po ng check, dapat po lahat yan meron doon sa requisition form natin. Si ICD-10 code or yung diagnosis, somehow, this is not vital for us medtechs kasi hindi naman po tayo nagda-diagnose ng patient. But, eto nga po, makinig maigi. Ang diagnosis po kasi, kapag nilagay, yung probable diagnosis ni patient, kapag po nilagay ni doctor dun sa ating requisition form, magkakaroon kasi tayo ng idea kung ano yung pwede nating makita dun sa lab results niya. Okay? So, again, diagnosis, this is not a vital thing to be inputted in the laboratory requisition form. So, pwedeng mag-send sa atin si doktor na lab test or lab request na wala pong diagnosis, tatanggapin pa rin natin yan. But, the diagnosis can actually help the medtech to check kung ano yung pwede niyang makita doon sa lab test ni patient. Kasi po, pwede natin kasi i-correlate yung kanyang diagnosis based on the laboratory result. Kasi nga po, again, although hindi po tayo ang nagda-diagnose ng mga pasyente, meron po tayong idea dapat kung ano yung connection ng lab test doon sa resulta. Okay, so next thing here, ito po yung example ng ating laboratory requisition form. So, di ba yan, no? Doctor's name. So, for example, ito yung clinic name niya, the patient, ayan, patient, tapos address, age and sex, and of course, the date today, or the date of collection. Yan na. Vital po yan. Next thing that is vital, again, in a laboratory requisition form, is of course, yung test na kailangan nating i-perform. So, pwedeng i-check ni doktor kung CBC lang ba ang kailangan gawin, or any other thing. So, kung ano lang po ang laboratory request, yun lang po dapat ang i-perform natin. Because again, mahal po ang laboratory test. Okay? Ayan. Doctor's name with PRC number. So, yung requesting physician should be indicated here. Diba? Mawala na lahat yung mga billing information, insurance information. Huwag lang po itong mga naka-color red na box. Again, that is patient demographic info, patient's name, date of birth, yung age niya, tsaka yung gender, date. Then, here is yung kung anong laboratory test ang kailangang i-perform, the doctor's name or the requesting physician. And then, ito naman po, naka-color blue na box, yung diagnosis and the special request. This can be omitted naman or kahit hindi si doctor maglagay dyan, it's okay. But yung diagnosis can actually aid us kung ano yung pwede nating i-expect dun sa resulta ni pasyente. But then again, hindi mo naman po tayo yung nagda-diagnose. Basta ang mahalaga dito is yung mga may red na box. Again, that is patient demographic info, the test results to be requested, and the doctor's name or the physician's requesting physician. Okay, next, we have your laboratory directory. As discussed, the laboratory requisitions often provided information about the patient and the requested tests only. But the information provided on the requisition is only limited at best. Kasi, di ba, kung napansin nyo, ang ating mga information that is provided here is just about the patient and yung requesting test niya. But, the requisition does not include the information about how to process and store the specimen. Walang nakalagay doon kung paano natin ipaprocess yun. Or what the minimum volume may be for the test order. So, kailangan ba marami or pwede bang konti lang? Hindi yun naka-indicate doon sa lab requisition natin. It also does not include information about how often the laboratory performs that specific analysis if the physician needs to know this information. So, hindi provided itong mga ito dun sa lab request form. So, this additional information mentioned above, ito nga po, about the specimen collection and handling may be found in the laboratory directory. So, kumbaga parang ito yung manual natin sa laboratory kung paano natin gagawin yung mga different tests na yan at kung ano yung mga requirements nila. Yun po yung purpose ng ating lab directory or manual. Okay, next here we have your laboratory results or reports. So, of course, gumawa tayo ng test, mag-generate tayo ngayon ng resulta. Once the specimen has been processed, delivered to the correct department, and tested within the laboratory, a laboratory report is generated to transmit the test results back to the healthcare provider. So, ito yung resulta mismo. So, paano natin ibibigay dun sa doktor? At ano ba ang dapat na laman ng isang lab result? So, this is a typical example of a laboratory test result. So, kapag kayo po ay nagpa-lab test, pwedeng ganito yung makukuha nyo. So, this is an example of a hematology department lab result. Nagpa-lab test tong taong to ng CBC, tsaka differential count, also blood typing. Pwede rin po pala, by the way, ang blood typing, pwede rin po siya sa hematology. If not under serology, pwede po siya dito. Okay, so moving on again. So this is an example of a hematology blood test result. Specifically po, blood typing, tsaka complete blood count. According to this lab result, ito yung resulta niya. Then, ito yung parameters na tinest natin. At ito yung reference ranges. Okay? I repeat. Ito po, vital to ha, na meron sa ating lab result. Department. Yung mga test na ginawa, yung resulta ng pasyente, ayan, results nakalagay. So, according to this, the blood type of this patient is O positive siya. And then, ito yung mga parameters, CBC and diff count. This is the results of the patient, and these are the reference ranges or the normal values. So, if there is a test that is needing a normal value or the reference ranges, dapat po naka-indicate din yan sa ating lab result. Okay, so aside from that, so sige, done na tayo sa resulta. Ano pa daw po ang vital na mga parts ng ating lab results? So, una, so ito pwedeng omitted to, the logo or the facility. So, kung saan nyo siya pinagawa, pwedeng ilagay nila yan dyan. The reference number can also be indicated. Yung reference number class can vary depending on the laboratory. Kung ano man gusto nila, reference number ba, patient number ba, or yung specimen number, depends po yan sa kanila. So, basta parang dapat meron lang indicator kung ano yung reference number nung test na yun. Of course, the patient's name, dapat naka-indicate yan. The age and date of birth of the patient should be also indicated. And of course, yung kanyang gender, yung female nga or male. The requesting physician, the dates, when it is requested, when it was processed, and when it was released. The name and signature of the registered medical technologist with PRC license number. So, ayan, dito po yan pwede. And also, the name and signature of the pathologist or the head of the laboratory with also PRC license number. So, all of this should be indicated in the lab test result. Okay, moving on to another topic of Module 2, we have the 3 phases of laboratory testing. So, inside the laboratory, meron pong tinatawag na phases ng lab testing. So, first is we have the pre-analytical phase, the analytical phase, and the post-analytical phase. And ito pong nakikita nyo ngayong illustration, itong pabilog, ang laboratory phase po natin is actually just this one. Okay? So, ito po yung nangyayari sa loob ng inside ng sa inside ng laboratory or sa loob ng lab. Ito po, yung pre-analytical, analytical, and post-analytical phase. Meron din po tayo kasing tinatawag na post-laboratory phase at pre-laboratory phase, but hindi po natin to main na concern, okay? Yung diagnostic phase is somehow concerned by the other healthcare providers. So, tayo po as medtechs, ang pinaka-concern natin is the pre-laboratory, laboratory phase. That is, again, the pre-analytical, analytical, and post-analytical phase. So, ano po bang nangyayari dun sa mga analytical phase na yan, ma'am? So, in the pre-analytical phase, ayan, simula tayo sige dito sa physician's brain. So, for example is, nakipag-usap siya dun sa pasyente. And then, sinabi ng pasyente yung mga nararamdaman niya. Like, sumasakit po lagi yung dibdib ko, yung tiyan ko, etc. So, si physician ngayon magka-come up with a probable diagnosis. So, with that in mind, nag-order siya ng test. Then, kapag order niya ng test, ngayon is magko-collect tayo ng sample. Then, i-identify natin si patient. Ito po ang pinakamahalagang phase sa lahat ng to. I repeat, the most important phase in the laboratory testing is the patient identification. I repeat, the most important step in the laboratory testing is patient identification. Kasi po kung dito po nagkamali kayo agad sa patient ID, mali na po lahat ng resulta natin. It is a mortal sin na magkamali po tayo ng patient identification. Okay? So, kaya nga dapat lagi may label. So, dapat tama din naman yung label. Aside sa may label, dapat tama ang label. So, that will fall under the patient identification part. So, again, simula tayo dito sa ordering. Ito po yung pre-analytical phase. So, again, that is ordering, the collection of the sample, patient identification, correct patient identification, the transportation of the sample to the laboratory, and here, the pre-analytical phase is yung preparation po ng ating mga specimen. So, again, from here, hanggang dito po is the pre-analytical phase. Pre meaning kasi, di ba, before. So, before analytical or before analysis. And it is also indicated here the highest frequency of errors with high risk for patients happens under the pre-analytical phase. Because class, magkamali pa lang dito sa unang part. Kahit saan dito, nagkamali kayo, maaapektuhan na po lahat ng result hanggang dito sa post-analytical. Okay? So, ito po again, highest frequency of errors happens here with the highest risk for the patient. Magkamali ka ng patient ID mo, what if yung kinuhanan mo may sakit at yung totoong pasyente mo walang sakit? Diba? Mami-misdiagnose natin yung pasyente natin noon. So, with that in mind, dapat tama tayo lagi. Then, ayan, again, this is the pre-analytical phase. Then, from here, dun sa analytical phase hanggang sa post-analytical, these are less prone to errors compared with processes performed outside the lab. Kasi po maraming different factors kasi yung pre-analytical phase eh. Maraming factors na pwedeng mag-contribute dun sa errors na pwedeng mangyari. But definitely, once the specimen is already inside the lab, mas controlled na kasi natin. Yung environment, controlled natin siya. Yung mga pwedeng mangyari, yung mga procedures, kaya nating kontrolin. So, less prone na po siya ngayon sa errors. So, the analytical phase, andyan na po yung analysis mismo or yung testing natin. And then, the post-analytical phase, nandyan na po yung ating reporting. Okay, the results. Reporting of lab results. So, madali lang naman yan eh. Basta pag sinabi nating pre-analytical, this is yung parang preparation of the specimen and transport. Analytical phase is the specimen is being tested. Ito nga po. At yung post-analytical phase is results interpreted, stored, and communicated to the requesting doctor. Basta pag sinabing post-analytical, nandito na po yung reporting ng lab result. These are the most common possible encountered errors in the phases of the lab testing. Paki-take note po, meron tayong star here, but start muna tayo kay pre-analytical error. Ma'am, kailangan ko po ba kabisaduhin to lahat? The answer doon is hindi nyo po siya kailangan kabisaduhin, okay? Ang mahalagang isipin nyo kapag sinabi nating pre-analytical errors is those errors that can be done before the testing phase. O, ano ba mga ginagawa natin bago tayo mag-test? Patient ID. Tatanong mo name, date of birth niya, at other pertinent information regarding kay pasyente. So, pagkaroon ng incorrect patient identification, simula pa lang dito, mali ka na, hanggang dito sa dulo, mali ka na rin. Okay? Kaya ito po yung pinaka-major at pinaka-vital at pinakamalaking pagkakamali kapag tayo ay mali sa patient identification. Okay, also, improper patient preparation. Meron po tayong mga test na kailangan kunwari ng fasting or hindi dapat kumain yung pasyente sa loob ng 8 oras bago siya kuhanan ng dugo. Pag mali siya doon, mali yung patient preparation, mali na rin yung resultang ma-generate natin. Also, incorrect specimen collection, like mali ka na nilagyan na test tube. So, pwede po yan. Mislabeled specimen. So, may label nga, di ba? Nilagyan mo ng label kaso mali. Also, incorrect order of blood. This is something to do with the blood collection tube, which will be discussed later on sa in the next following weeks. Incorrect use of tubes for blood collection. Incorrect anticoagulant to blood ratio or short draw, like kulang yung dugo na nakuha mo. Improper mixing of blood and anticoagulant in the blood collection tube. Incorrect specimen preservation. Mishandled specimen, and incorrect data logging. These are the possible encountered errors in the pre-analytical phase. Basta lahat ng errors na pwedeng mangyari before the testing, dito po yan. Next is the analytical errors or yung testing phase na natin. So, pwedeng encountered errors here is incorrect sample and reagent volume. So, dun sa machine, mali ka ng volume na nilagay. Dapat pala 5 ml. Ang nilagay mo is 10 ml. So, mali na yon. Also, incorrect incubation of the solution or the reagents. Equipment or instrument malfunction. So, yung machine talaga natin may mali. So, magkakamali yung test natin yan. Improper calibration of the equipment or there is a calibration error. Those are under analytical error. Then we also have here your post-analytical errors, which is a good example is unavailable or delayed lab results. Please do take note that there is a recall question here, which is the turnaround time. Turnaround time indicates the time na from the receipt hanggang sa mailabas natin yung resulta. Diba? Turnaround. So, turnaround parang pagbalik ng resulta sa doktor. Parang ganon. So, yun po yung long turnaround time. That is under the post-analytical error. I repeat, please take note, this is a recall question. Long turnaround time is under the post-analytical error. I repeat, turnaround time is under post-analytical phase. Okay? Paki-take note po, recall question po yan sa board exam. Also, missing incomplete lab results. So, kulang. So, basta something to do with the lab result, post-analytical yan. Wrong transcription of the patient's data and the lab results. So, mali. May mali ka somewhere doon. And lab results submitted to the wrong doctor who did not request for the lab test. These are the possible encountered errors in the phases of the laboratory. Thank you for listening. If you have any more questions, please do message me at this